And it's not just a matter of living or dying. It's not just, if you get over COVID, you're not done with it. Many people have long-term consequences and long-term health problems related to it. So you may, if you don't die from it, you may have to live with it, and it creates a whole new set of problems as well too. So it's not appropriate to say, well, I'll just get it, be done with it, and move on, because many, many people have long-term consequences. I know we're all exhausted with COVID fatigue, as Dr. Joshi mentioned. The interesting thing about this pandemic is that the final chapter hasn't been written yet, but we have the ability to write it. We can determine how this pandemic ends, and all the efforts that you've heard about today, they really work. We have to just, we'll get through it. This is not an existential threat to our civilization. We're going to get through it. We just have to push through this next phase. Probably the next 6 to 12 weeks are going to be very tough. And then after that, hopefully it will start to get better. But we just have to gear up and get through it, and we will. And with that, I'd like to present the Mayor Alsbury, the Mayor of Hazel Crest. Thank you.
Thank you, Doctor. Thank you, Governor, for being here in the Southland. Thank you, Dr. Ezeki. And thank you, all your healthcare professionals and our state legislators for being here today in the village of Hazel Crest at Advocate Aurora Hospital. I'm going to bring it home now because I want to talk to the people in the Southland and, more importantly, the individuals here in the village of Hazel Crest and East Hazel Crest, Country Club Hills, and Markham. As of October 26th, there are a total of 22,905 confirmed cases of COVID-19 in our region. 308,258 tested performed for residents of the region. The positivity rate is 7.43%. 2,646 cases were reported through the South Suburban Mayors and Manager region over the past 7 days. 491 deaths reported in the South Suburban Mayors and Managers communities. That's 45 communities in our region, plus additional deaths in Will County. Hazel Crest, in the 60429 zip code, which includes Hazel Crest and East Hazel Crest, there have been 481 total cases. 30 new cases occurred within the past week. More than half of the 481 cases involve patients younger than 50 years old. More than half of the 481 cases reported are Black. However, the positivity rate are higher for Hispanics than are for Blacks. 19 deaths have been reported in the village of Hazel Crest. For a town this size, that's unbelievable. We have to do better. In the Southland, we have not just been sitting idly by as this virus has and the pandemic has attacked our state and our region. Many of the organizations out here in the South suburbs, led and supported by state legislators, our county, the state of Illinois as a whole, and not-for-profit organizations such as United Way and Chicago Community Trust, have supported a group that we have put together called the South-Southwest Comprehensive Strategic Partnership. This group, or collaboration, consists of over 60 different organizations in the Southland. Unlike metropolitan Chicago, we have great not-for-profit organizations and healthcare providers, but we do not have an umbrella city that encompasses all of those. So we decided to come together to move forward, to support what the governor's doing, but actually doing things in our region to support it. The Southland has been hit hard by COVID, and the numbers are alarming. As I said earlier, African Americans, as well as those residing in living facilities, or long-term living facilities, have proven to be the most vulnerable, drastically demonstrating both high incidence of COVID-19 and death rates. The South-Southwest Comprehensive Strategic Partnership was established to respond to the COVID pandemic in the South suburbs. And as I said earlier, over 30 organizations represent these organizations. It's healthcare providers, hospitals such as South Suburban Advocate, Ingalls Hospital, St. James, community faith organizations, behavioral health organizations, because we're finding that mental health, because of this COVID, it's not only COVID fatigue, It's also the mental stress that it puts on families and individuals. They are part of this organization, along with other faith-based organizations. We launched a Mask Up program, which was supported by Cook County 2 months ago. And if you drive through the village of Hazel Crest, Governor, you'll notice on our 3 billboards that we have here, you'll see our president, Rashad Johnson, without a mask and then with a mask. You'll see myself without a mask, with a mask. And some of our faith-based leaders without a mask and with a mask, pushing home the fact that you have to wear a mask. That's the first line of defense. We also have our school children. We had a School District 144 basketball team who won the 8th grade championship. They also have masked up. So, representing not only the Southland Mayors and Managers Organization, the South Suburban Regional Black Mayors Caucus, and our other organizations in the Southland, I'm asking all of you, all of us, to mask up, wash up, and make the distance between each of you. And just to let you know how we're supporting the governor and the efforts, not only by the state, the village of Hazel Crest on October the 7th, on Wednesday, October the 7th, and on Sunday, October the 10th, we had over 200 people test at our village for COVID-19. And on Wednesday, October 28th, 2020, from 11 to 3 p.m., we'll be providing free flu shots given by Walgreens and Oscos. So we're trying to do our part in fighting this virus. Let's do our part. Let's mask up. Thank you. Governor?
Thank you. And before I take questions, I just want to emphasize something. It takes great local leadership for us to get past this pandemic. This isn't just a state government responsibility. It is the responsibility of our local mayors and local city councils to enforce, to make sure that they're setting a great example. And that's what Mayor Alsbury has been doing. We have a lot of great local leadership around the state that is helping out. And I just want to emphasize that these are the people who are really doing the hard work on the front lines to make sure that we're getting this right. So thank you very much, Mayor, for all the work that you're doing and will continue to do throughout this winter. And now I'd be happy to take any questions from members of the media.
Governor Pritzker, the governor grants and loans are not enough to help a lot of bars and restaurants that were teetering on the edge of closing. As you know, 5,000 bars and restaurants in the state of Illinois have already closed. Their point of contention is this science behind the mitigation efforts that George put out, and I did read through it, so did a lot of people tweet it out so they could read it. These contract tracers did 69 of the 97 counties. People in each county want the breakouts for their counties. Because if you're at a restaurant,
Yep.
what are the chances that you're also at a grocery store, at a pharmacy, or at work, or at church, or something?
Yeah, for virtually every county, the county public health director and the public health department are responsible for putting out that information for each individual county. And the state, of course, receives information like that. And we're looking to put up more information such as what you're suggesting. I would just say back to you, Amy, that, I would appreciate it if you would spend a little more time promoting people wearing masks, promoting people doing the right thing in this very difficult time when people are dying and getting sick, and a little less time sort of ginning up the idea that this is a hoax or giving people a platform for the idea that this is some sort of conspiracy. I just want to point out every day, now you ask question after question, let me answer you. Question after question is always about trying to find something that might have been done wrong along the way. And the reality is we're all trying very hard to get this right. All across the country, every state is fighting this right now. Can you not see that? That COVID is rising everywhere. Let's not try and find the loopholes here and there, but instead find ways that we can promote safety and health. Yes.
Governor, can we talk about the restrictions being imposed on Chicago? And if we can go over again what the metrics were to reach that, because
Sure.
as you pointed out, it was different than it's been for the rest of the state. It sounds like it was similar to Cook County, where it has to do with an increase in the number of days of positivity and also hospitalization.
Correct.
If we can go into that, and also have you already spoken to the mayor
Yeah, I've been in contact with the mayor. Let me go back to the basic question you asked, which is there have always been, from the very beginning of our resurgence mitigations, two ways that a region might go into those resurgence mitigations. One, which is the one I frankly thought was the less likely one to trigger mitigations when we first put them in, just my own opinion. And that was the 3 days in a row of 8% positivity. At that time, 8% seemed like we're not going to get there. That's, we're so far away from 8%. And so I just didn't expect that would be the one. And instead, I thought that, the more likely one would be that there would be an increase in hospitalizations on a consistent basis and an increase in positivity rates, but not necessarily triggering 8% 3 days in a row. So what do you know? The very first several regions triggered the 8% 3 days in a row. So it seems unusual now, right, that we have our first one now that's triggered the others. What are those metrics? 7 days out of 10 of increased hospitalizations and 7 days out of 10 of increased positivity rates. So in other words, and this is again a little bit from the modelers, a little bit from the epidemiologists, that when you see a consistent upward trend like this in those two metrics, what you're seeing is that you're probably going to continue in that direction unless you do something more to bring down the positivity rate, bring down the hospitalizations. You've got to put some mitigations in place to try to, flatten that upward direction and bring it back down again.
Maybe this is a question for Dr. Ezike, but I guess in Chicago there's been a little bit of a lull into, it's the suburbs where this is resurging and we're still doing really well. And it wasn't until maybe the last couple of days that there was a sense of, oh wait, it's starting to catch up. When did you start getting worried about the city of Chicago?
I just want to answer one part of that, and then I'll get out of the way. And that is that I'm hoping that people are looking at the metrics frequently, especially people who are in leadership across all of the cities, towns, counties that are affected. And if they had been watching, Chicago has been on an upward trend. I think we heard this from Dr. Arwoody earlier today and has said this for a couple of days, that actually the upward trend has been going on for some time now. So it shouldn't be a surprise to anyone who's been following the metrics to see that, this was a direction and potentially a likely thing that would happen. Having said that, so the data is available for people to look at, so they shouldn't be surprised. Having said that, I'll turn it over to Dr. Ezike.
Sure, I think you've covered it. Again, we publish the metrics for each of the 11 regions like every single day. And if you go back in time, I'm trying to rewind. 4 weeks ago, the statewide average was 4.5. So for us to have gone from 4.5 to nearly 7.5 in just 4 weeks, again, we were at 5%, I think October 7th, we were at 5%. So we're talking about in a matter of 3 weeks, less than 3 weeks, we've gone from 5 to over 7. So the rate of climbing is very significant. And again, people want to poke holes in stats. You can't deny people in the hospital with COVID. You can't deny people who have died with it. So all of these metrics are moving in the same direction, which really validates that this test positivity really does give you that inkling. And the fact that the test positivity goes up is followed by cases going up, followed by hospitalizations going up, followed by deaths. And that's the trend, the trajectory that we need to turn around.
Dr. Ezike, can I ask you about the mental health aspect of this? Cook County, there have been 5 deaths, 19 younger from COVID. All of them have comorbidities. But we've had 23 suicides. A girl threw herself in front of a train the other day because they can't do theater, they can't go to school, they can't play their sports. And what about the mental health aspect of this? It has to be addressed. The Lexington brothers, their beds are full. I mean, we all know people that have committed suicide or had drug overdoses and heart attacks because of them. How are we going to address that? And we need more hospital beds for that aspect of this.
We absolutely do. The whole world is traumatized. This is a traumatic event that we are all facing together. And so I am not disputing anything that you're saying. Mental health is part of our physical health. We've always known that we have a lack of mental health providers of different backgrounds. Some of the communities that need it most have the biggest dearth. So I think we're on the same page with that. I think the fact that people are committing suicide is a testament to the amount of mental health exercises and first aid, mental health first aid that we all need. I would also suggest, again, not being able to talk to people who have passed on from suicide. There are many things that are going on. This is a frustrating time. I would also suggest that as we try to minimize the deaths, I can tell you that people who have lost a loved one to COVID are also traumatized, and they probably feel just unbearable grief and have committed and have thought about committing acts of harm. So everything that this virus has caused pain, has caused mental anguish, and I think, unfortunately, some people have dealt with it. Like you may have said, there could be many other things going on. There could be underlying conditions of mental health that have not been addressed. But we all need some mental health first aid, and we all need to try to take care of ourselves and our neighbors as best we can.
One more question? I'd like to just respond to one aspect of that. Look, every life lost is, especially to suicide, but every life lost is one that we should be mourning. And suicide is the most bewildering, I think, for many people. I know that as of a few weeks ago, the suicide numbers in the state of Illinois have not changed year over year in any significant way. That doesn't mean that we shouldn't continue to watch it, and it doesn't mean that there isn't somebody out there that, because of the trauma that they're experiencing in this moment and some other mental health challenge that they have, didn't work together to have them decide that they would commit suicide. But it is something that we ought to be watching. And mental health treatment is something we weren't doing well across the state of Illinois, in my view, before we got to COVID. For many years, in fact, we haven't had enough beds available for people or enough treatment available for people who are suffering from mental health challenges. We've got to put it on the same level as we do physical health. There's no doubt about that. So we've continued to try to do that in my administration broadly, but especially in this moment, I think we should be on guard and watching to help people who are suffering. One more question I heard. Yeah.
Dr. Sitterberg, a question?
Sure.
Hello. Good to see you again. Dr. Rush told me that there are more hospitalizations, that's true, but they're not as severe as the first wave because we have better therapeutics. Is that what you've seen at your hospital and other hospitals in the area?
We definitely have better therapeutics now than we did back in March and April. We have drugs that we can use. We have drugs like remdesivir and dexamethasone, convalescent plasma that all help. They're certainly not magic bullets, but they do help to reduce the severity of the disease. However, the key is to not have someone need to come in the hospital. How do we prevent hospitalization? By preventing the disease. Because once you come into the hospital with COVID-19, even though we do have better therapeutics now than we did before, you're still at risk for dying. And not only, as I mentioned before, not only dying, but also living with complications of COVID-19, which could also be quite severe.
All right. Thank you, everyone.
everyone. Welcome to our daily COVID-19 update briefing. Dr. Ngozi Ezike and I are joined here in Chicago's south suburbs at Advocate South Suburban Hospital by Richard Johnson, president of Advocate South Suburban Hospital, Dr. Kiran Joshi, senior medical officer of the Cook County Department of Public Health, Dr. Daniel Johnson, an expert in pediatric infectious diseases at the University of Chicago Medicine, Dr. Robert Citronberg, executive medical director at Advocate Aurora Health, leader Will Davis, Representative Debbie Myers-Martin, and Hazelcrest Mayor Bernard Alsbury. We're here in suburban Cook County, Region 10, which this week became the first region in Illinois to trigger additional mitigations, not because of its positivity rate alone, but because its positivity rate and its COVID-related hospitalizations have both seen a sustained increase over the last 10 days. Just to paint a brief picture for the region, today's positivity rate for suburban Cook is 8.0%. That's more than 4 points higher than the region's low positivity rate of 3.9% over the summer, as well as a full 3.6% higher than the rate was in late September. And in that same time, we went from a statewide testing rate of approximately 30,000 tests per day in early July to more than 70,000 now. So it's not just that we're testing more, it's that there are more positive cases in the community to find. The same goes for hospital admissions. In June, Region 10 hit a low of about 10 COVID-19 related hospital admissions per day. That figure ticked upwards through the summer, hitting a warm month average high of 33 new COVID admissions per day, and then dropping back down to the low 20s in late September. But we've surged again. How high? Suburban Cook County is now admitting an average of 50 COVID patients to the hospital systems per day. That's 5 times as high as it was in June. Earlier, I mentioned that suburban Cook County was the first of our 11 Restore Illinois regions to trigger traditional mitigations, not because of its positivity rate alone, but because of its positivity rate and its COVID-related hospitalizations. And both have seen a sustained increase. And today we have a second region that has hit that set of metrics. Region 11, the city of Chicago, has now seen its COVID-related hospital admissions and its positivity rate increase more than 7 of the last 10 days. Region 11 is now averaging more than twice as many COVID-related hospital admissions per day as it was a month ago, with a positivity rate that has almost doubled since the beginning of October. For a time late in the summer, Chicago seemed to have this more under control than other regions of Illinois, but that's no longer the case. So starting on Friday at 12:01 a.m. in the city of Chicago, and tomorrow at 12:01 a.m. here in suburban Cook County and in Metro East, public gatherings will be reduced to 25 people, and indoor restaurant, dining service, and indoor bar service will be temporarily closed, although, again, outdoor service in tents and igloos, as well as pickup and delivery will continue. As more and more studies continue to show, this virus primarily transmits through respiratory transmission, person to person. Therefore, situations where people are more likely to experience that transmission, such as where they're singing or eating or drinking all without a mask, take on a greater concern when we are seeing high rates of community spread. These mitigations aim to cut down on those high-risk activities until we can bring down the positivity rate in an area once again. In other words, the situation here in all of Cook County, city and suburbs alike, is bad, and it's getting worse. Yes, we know more about how to fight this virus than we did in the spring, but there is still no cure. there is still no vaccine. We are aware of no treatments that prevent a patient from deteriorating to the point where they need hospital treatment. And the hospital treatments we do have are far from guaranteed to work. There is an unfair burden of risk on our elderly residents, our immunocompromised friends and family, our frontline workers, and our healthcare staff when community transmission is soaring like it is right here, right now. On the positive side, people here in the south suburbs and all across Cook County are already taking advantage of the testing that we've ramped up and that we've made available to you. And I encourage everyone to take advantage of that. I'm pleased to see that testing in both Region 10 and 11, suburban Cook County and the city, is up about 50% in the last month alone. We have community-based testing sites at South Suburban College in South Holland, at the Arlington Racetrack in Arlington Heights, and in Harwood Heights, all of which operate 7 days a week. We've also had a mobile team in Evanston Monday and today, and we'll be deploying one to Blue Island this Saturday and Sunday. There are many other testing sites that you can find, and you can go to our website at dph.illinois.gov/testing to find a testing site near you. In Chicago, we have state-run operations in Auburn Gresham that operate 7 days a week, 8 hours a day, and multiple free locations can be found online at chicagocovidtesting.com, another website you could visit to find a testing site. And that's on top of the hundreds of clinics and hospitals and federally qualified health center partners that we have, not just in these regions, but statewide. Illinois is the best testing state in the Midwest. Please take advantage of that. Remember, these tests are free and fast and available to anyone who shows up. Outside of Regions 10 and 11, the regions not experiencing state-enacted stricter mitigations are also trending in a bad direction. Today is Region 9's second day at a positivity rate above 8%, which means the region could meet the metrics of additional mitigations as soon as tomorrow. Region 3 reported a positivity rate above 8% for the first time today, and Region 6 is close behind at a rate of 7.9%. If these trends continue, these regions, which span most of central Illinois, could see additional mitigations this week. Region 2, which stretches from Kendall to Rock Island counties and includes Peoria, is also edging closer and closer to the 8% metric, with now a 7.5% rolling positivity average. In other words, this is a problem affecting all of Illinois to one degree or another. We can't ignore what is happening all around us, because without action, this could look worse than anything that we saw last spring. It's with that in mind that today my administration is releasing our updated guidance for youth and adult recreational sports in Illinois ahead of the winter season, evaluating which sports can continue right now in relative safety and which require modifications to what can happen right now versus what kind of play needs to be delayed. Just like with fall sports, nothing is canceled, but some tournament play is being put on hold until we're through the thick of this pandemic. We adapt as we learn. That has been our mantra throughout the pandemic, as is true in every other facet of life. We know that this virus is of most concern when people are indoors with high contact, especially in vigorous situations that bring about heavy breathing, like in wrestling, hockey, and basketball. Sports played at a distance, like tennis, can be played, and sports that can be modified to have virtual elements, like dance, for example, offer more leeway in this moment, and the IDPH guidance reflects that. Whether this year is their first time on the court or it's their senior year season, this isn't the news that anyone wants to hear, and it's not news that I want to deliver. But this virus remains dangerous and deadly to kids and parents, and especially grandparents. And this is the best thing that we can do for the health and safety of families under the current circumstances. Life in a pandemic is hard for everyone, and it's hard for all of our kids, whether or not they play sports. Our goal is to make sure kids can play at some level, whether it's training and conditioning together or fully competing, whatever can be done safely with this virus still ever present. Of course, if sports were the only gateway into the pandemic, we'd have solved this problem a long time ago. So let me take this opportunity to remind everyone that cases and hospitalizations and deaths are rising everywhere in our state, across the entire Midwest and across the nation. We have to act responsibly and work together to protect the people that we love and this entire state. So please, no matter where you live, what your politics are, where you work, or who you love, Illinois, please mask up. Please mask up. And we'll get through all of this together. And with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor?
Good afternoon, everyone. I will just give some real talk. When it comes to this virus, we